from the Illinois Department of Health. State officials announcing 54 new deaths and more than 1,200 new cases today, although that is the lowest number of new cases we've seen in 3 weeks. The governor also announcing Illinois' peak expected now in mid-June.
And the governor and his office join the millions of folks working from home.
This after a senior staff member tested positive for COVID-19. WGN's Sean Lewis joins us now with more from the governor's news conference and also a major announcement about the drug remdesivir.
Yeah, some promise shown from remdesivir. Illinois just got a new shipment over the weekend. The governor says he has had contact with that senior staffer over the past few weeks who tested positive, but the contact has been limited. Today there was a new workflow for the governor's office, including for the governor himself.
I feel fine and I have tested negative, and so I don't think, at least at the moment, that there's any real danger.
Since one of his senior staff was confirmed COVID positive last week during routine testing, the staffer showed no COVID symptoms.
I don't have regular, everyday contact with that person directly, although that person would every day sit in a large meeting room where we were all socially distancing.
Since last week, the governor's been tested twice, both times negative. Also announced today, the state receiving 140 cases of the drug remdesivir over the weekend. So far, it's proved a promising treatment for COVID-19. Illinois' allocation will treat upwards of 700 patients and was distributed to 14 hospitals across the state, the bulk of which are in the Chicago area.
We do expect to receive more remdesivir in the future, but our hope is that the allocation that we received on Saturday can already help to improve outcomes for some patients who need it most.
And while the lowest number of new cases in weeks was reported today, there was some discouraging news. It's believed a virus peak will now not come until mid-June. Still, much of the state is on track to meet the requirements to move to the less restrictive Phase 3 of the 5-phase Restore Illinois plan. 3 of the 4 regions of the state are far below the 20% positive test rate required to move to a new phase. The only exception, the Northeast region, including Chicago, with a positive test rate of more than 22%. This as Republican state lawmakers are asking the governor to reconsider his plan to reopen the state faster.
The goal here is to, as I say, reopen the state as fast as possible, but in a safe fashion.
The governor also announcing jobs, hiring a team to serve as contact tracers who will track down those who may have had contact with those who test positive for COVID-19.
People will be trained for free as part of the contact tracing program that we're going to be, that we're spinning up. And so it is not necessary for people to pay for a program if they get hired as a contact tracer. You get hired not based upon having a credential as a contact tracer, though we will be hiring healthcare workers. There are people who are community healthcare workers who have some of the training that's already required. And so those folks will be among the first that get brought in.
It is estimated that the state will need about 3,800 contact tracers to meet the demand. The program costing about $80 million. The hiring of those tracers will be done through county health departments and overseen by the state. Contact tracing along with increased testing, those are some of the big keys to be able to reopen the state eventually.
All right. Thanks, Sean.
You bet.